hey, we have access to the data set from Change Healthcare.
And they're saying, hey, pay us. If not, we'll expose it and all that. One of the biggest ones is Change Healthcare. They were bought out by United Healthcare back in 2022. United Healthcare is huge insurer. Change Healthcare, it processes something around 30 million transactions per day, over 100,000 different hospital systems. Then we ran into February 21st, where there was a huge cyber attack against Change Healthcare. It's one of the largest hacks we've seen in healthcare.
We definitely experienced that. I had seen something too along the lines of 1 in 3 Americans would be impacted by the Change Healthcare. That's kind of the market share that they had. A lot of these payers were exclusive to Change Healthcare. We kind of went into emergency and crisis mode. What we found out is...
Hey everyone, I'm super excited today as I have Gregory Carlson on the call. We're going to discuss medical billing and answer all your questions when it comes to all the changes that are happening currently right now. So this will be a great informative session to kind of really deep dive into things you can do to maneuver what's happening right now in the space of medical billing. So Greg, welcome to the call and thank you for your time today. Talk a little bit about your background and some of the things that you've been involved in and your expertise in medical billing.
Yeah, absolutely. I appreciate you having me on. My name is Gregory Carlson. I've been in RCM services or revenue cycle management under healthcare for about 23 years now. I've done all levels of medical billing and coding. I have worked both in the hospital and in the outpatient setting, so both professional and institutional claims. I have worked with many EMRs as well as different practice management systems, and I'm very familiar with multiple clearinghouses and their setup and function of clearinghouses as in general and how to make them work for you correctly.
Awesome. Yeah. So the reason why this came about, Greg works with us from time to time from a consulting standpoint to help us with medical billing questions and a lot of things that come up with medical billing and understanding how it all works. Let's start with the basics, Greg. So one of the things that comes up is medical billing versus medical coding. What's the difference and what do billers and coders do? Can you break that down and explain that to the audience?
Medical coding, you can actually become certified in medical coding. So through the AAPC and other certifications, so the American Association of Professional Coders, really what coding is, taking notes that a professional is creating for their visits with the patient and assigning either diagnosis or procedure codes based on those notes. So a medical coder is actually able to go in and physically code services for billing for a provider. They can do this for both professionals, they can do this for hospitals. Really, it is more understanding notes and understanding diagnoses and really being able to go in and use their knowledge as well as resources in order to best code for both documentation as well as reimbursement. Now, many medical billers can be medical coders, but not all. So medical billing is just the practice of being able to take what the providers are doing, generate medical claims, and follow up for payment. So many medical billers are coders, not all, and many coders are medical billers, but again, not all. And so medical billing, less of a science, but it's more of the art of understanding insurances, understanding how the claims flow through the process, and understanding the best way to be reimbursed for the services that you're doing. It's whether or not you need to obtain authorization, whether or not there's coordination of benefits, how to navigate denials that come back from insurances, and really just how to understand how to navigate insurances as well as payments that are coming back from them in order to have the best experience in getting reimbursement for the services that you provide.
Thank you for that synopsis and understanding the two. Can be a little confusing because they can kind of wear multiple hats, right?
Absolutely.
Dealing with medical billing. So if I was starting out as a medical biller today, wanted to get into this space, what should a medical biller have to know, right? What kind of basic skill level? Are there certifications they need to have? Kind of break down like if I was just starting out trying to become a medical biller today.
Yeah, so there definitely are some certifications out there. There's various organizations that do provide certifications. The most basic understanding for a medical biller is really understanding how insurances work. So the basest line of understanding is understanding authorizations, understanding copays, understanding various insurances, kind of the different pieces of that nature. That's really the baseline of what medical billers need to know. But really, it becomes more involved than that. It becomes into understanding what modifiers need to be added in order to to get claims paid, understanding the nuances of certain insurances want codes different than other codes. For example, Medicare has some codes that they'll use that are specific to Medicare. They're not necessarily a procedure code that would be used for other insurances, and understanding how to navigate that. So really, if somebody's getting into medical billing and coding, two things I would say: look into the classes, and they don't have to be these year-long certification programs or anything like that. Those are good, but they can also be, educational courses that are explaining things and helping people understand how to get into the industry. There's a lot of nuances, and a lot of what you're going to learn as a medical biller if you're new is going to be a lot of on-the-job things. So there's a lot of things that just come up as you're going, really learning kind of as you're maneuvering and going through the different pieces. You're going to learn a lot more just working claims. But the thing I would say for anybody who's brand new is be very inquisitive. There's a lot of different things, and there's a lot of people in the industry who have been doing it a long time and have experienced a lot of things. And there's going to be a lot of things that you're going to see that happens for one payer and then ends up happening for another payer. And then you end up understanding how to resolve that kind of across the board. There's a lot of things where it does transcend different payers, but every once in a while, I'm still surprised where I see something and I've never seen an insurance do that. But a lot of times it's a lot of the same common things. So you do definitely get into a sense of understanding and kind of how to align yourself to make sure that you're getting everything out correctly on the front end in order to reduce denials and reduce some of the issues with insurances.
And so to your point, there's all these different specialties that have nuances around billing. If you're billing for a cardiologist, understanding the nuances around that versus a nephrologist versus a different type of nuances and how insurance handles different procedure codes. And then you mentioned also basic understanding of math and, doing basic math, but also negotiation. So you're always on a call with the insurer, talking to them, understanding why a claim may have been denied and getting more understanding of that and kind of communicating to them. How many times do you do that, Greg? Would you say the negotiations piece of the job?
I mean,
sure,
that's definitely common. So a lot of times you'll get on with an insurance and, you can even get on, a lot of times they're reading what their system's saying to you and it may not make sense. One of the things you have to become comfortable with is not taking everything at face value that you're told by an insurance company. A lot of times it's not necessarily that they're trying to give you bad information or they're trying to give you incorrect setup of things. It can honestly be that they don't understand or they're just reading off a script. And sometimes the codes that the insurances use for denials or use for payment don't always match what should be reality. So I think the important thing to note is that when you're negotiating or when you're having discussions with insurance companies, really understanding that not always are you working with somebody who understands all the nuances of billing. A lot of times it can be a call center representative or somebody who's there to essentially handle calls and read a screen and give you a reference number. A lot of times you have to dig a little bit deeper and kind of learn the different questions that you need to ask in order to get to the information that you're looking for. A lot of time you'll get one answer. Sometimes you'll actually get one answer, and then if you call back in 20 minutes and talk to somebody else, you'll get a different answer. Really understanding what's going on with claims and understanding why something might be denied will help you when you go into speaking with the insurance company. So if you have a good understanding of what's going on before you even call, you'll definitely be in a lot better spot than if you go in expecting them to help you with everything, because they're only allowed to tell you certain things. They can't tell you how to code. They can't tell you what modifiers to use. They can't tell you what diagnoses to use. They can really just kind of tell you why the claim is kicking out of their system. And sometimes they may not even understand the best of why it's kicking out.
And just really, being organized and making sure you have a process flow, how you manage this. So things always change. Yes, they release new versions and codes like every year, but in the middle of the year, they can make adjustments and things of that nature. So it's always a challenge to making sure you keep up with the latest and greatest and organize in a communicative way to the insurer. They may not even know some of the changes, right? When you talk to some of the people. Yeah, and we just went through that. Obviously, we had a huge change in healthcare where they made more flexibility due to the pandemic and things of that nature. So there's a lot of moving parts, and now we're starting to try to get back to somewhat normal, but there's always changes happening in this space. Well, let's talk a little bit about how when you start doing medical billing, typically you have to send it to these things called clearinghouses. So can you explain what clearinghouses are and how does that work when it comes to medical billing?
Absolutely. So a clearinghouse is really a intermediary. So really a go-between with your practice management or EMR and the insurance company. Very few insurance companies have been allowing direct submission of claims, and it is a lot more efficient to send them through a clearinghouse. So essentially what happens at a clearinghouse is your system, so your practice management system, or your EMR, wherever, or EHR, whatever you may be using, basically creates these billing files when you're sending out billing. And there's specific electronic claim files that the standards are set by the industry. Everybody has to accept the same type of file. The clearinghouse really takes that file that's coming out of your system and then parses it out to the different insurance companies. So one of the common misconceptions is that you have to send over all of your one insurance claims and then all of your other insurance claims. With a clearinghouse, you can just send all of your claims over to the clearinghouse, and the clearinghouse then essentially takes your file, parses it out, and sends it out to where it needs to go. Many of them also have edits on the front end. So if there is something that is not a valid code or not a valid insurance or things of that nature, where it will actually tell you that the claim has failed, or more commonly the term is rejected. It can tell you, hey, this is not going to get through to the insurance company. There's something you need to change. Usually the clearinghouse will tell you, like, this patient ID doesn't match the format, or this insurance isn't active, and things of that nature. So those are some of the front end edits that clearinghouses can have. They also get responses back from insurance companies on edits. So if you send over a claim and the patient's insurance is termed, or the patient's name is invalid, or their date of birth is wrong, or something along those lines, the insurance company will actually send those back, and then the clearinghouse will kind of tell you in a quick manner and allow you, many of them allow you to actually correct it on the clearinghouse. So say you have John down as the name and it's supposed to be Jonathan. You can update your practice management, but for expeditious processing, a lot of the clearinghouses actually allow you to go in and update them directly on there and resubmit the claims through there. Also, then what happens is with the insurance companies, most of them will send back electronic files for your explanation of benefits and payments, known as ERAs, which is electronic remittance advice. And those will come through, and the clearinghouse can then, one, make those human readable, where you can actually look at it and it looks like a standard EOB that you're used to seeing, and then also take those files and bring them into your practice management system for electronic posting. And so really the clearinghouse, again, that go-between between you and the insurance companies in order to get claims processed and get the responses back from the insurance company.
And that makes sense, right? It kind of helps to have a standard before it kind of gets sent. So that's how you can process millions and millions of claims every month, because you need to have a standardization to make the processing faster. So the clearinghouses just make sure that is cleaned up, because you're right, everybody has different ways of how they submit claims or how they want to submit it and all that. I mean, you've been in medical billing a long time when it was just, paper. I'm sure there was a lot of mistakes, a lot of things that were issues and mistakes that were happening, and, claim denials. But the clearinghouses do offer a great function. Is that correct?
Yeah, they do. And one of the things, kind of going back to the old paper days, which I don't want to go back to, and you still get it every once in a while, where the payer says, oh, we never got that claim, or, oh, we didn't get that claim in time for payment. And so one of the other things that the clearinghouses can do is they provide electronic tracking of your files. So if a payer does come back and say, oh, we didn't get this in time, and you can go in the clearinghouse and provide them proof and say, hey, this says right here that you got this claim electronically and this was received and you accepted it on this date, and here's the tracking number. And then the payer really doesn't have a leg to stand on when they try and deny you for not sending the claim in time. There is a lot of different things going through a clearinghouse that it does help with that weren't available. And I would say it's even improved over the last 5-10 years. It's gotten significantly more functionality and availability. And a lot of your clearinghouses have reports where you can see, kind of what claims have been sent, what has been resolved, or what are your top reasons for claims getting denied or rejected. So that way you can work with your teams in order to get those common issues resolved and common problems and denials resolved kind of better on the front end. So there really is a lot of functionality with most clearinghouses and a lot of things that weren't available years back here. Medicare has always been a little bit more ahead of the game when it comes to electronic pieces. They've actually gotten bypassed now by many of these other insurance companies, many of the other plans, but Medicare has been taking electronic claims for a long time. But in general, there's very, very few payers out there left that don't take electronic claims, and many of them are very specific to a region or a very specific type of payer that needs outlined paper claims. But for the most part, everyone is taking electronically, and it's also faster. So if you're sending something through electronically, it's going to be at the insurance within hours. Whereas if you're mailing it on paper, you're at best going to get it there in a couple of days. And then when it gets there, how long is it sitting in the mailroom? How long is it sitting on a desk to get scanned in? How long is it really taking to get processed? versus if you're able to send electronically, it's pretty instantaneous. And sometimes there's a few payers out there, if you send over a claim today electronically, they're going to have an EOB for you within 48 hours or they're releasing payment to you. So there are definitely some of those out there, and I would always recommend going electronic whenever available.
Nah, I love that. And so look, it was a purpose, just like a lot of things in healthcare may not make sense sometimes, but there's a purpose, and it was trying to do something great and wonderful and help people and make the process easy and cleaner. But just like anything in healthcare, consolidation happens. So we have all these different clearinghouses, and then I think certain clearinghouses start to get more and more market share, right, over time. And one of the biggest ones is Change Healthcare, right? I think they were bought out by United Healthcare back in I want to say 2022. Does that sound about right?
Yeah.
So right after the pandemic, United Healthcare's huge insurer, which is also to gobble up a lot of different things. One of the things they said, hey, let's purchase a clearinghouse, right? Because in their mind, from my understanding, it would make it easier for them to kind of see all the different claims that kind of come in, and they can understand how processing is done. Rumor was that they could also see other insurers and what they were charging, right? Potentially, and kind of help with their their health plans, right? Because they're insurers, so they can change their health plans based on what they're seeing with the data. So anyway, so they purchased it. There was some Department of Justice issues that came in with that merger, saying it could have been some issues with unfair competition, but it went through. Then we ran into February 21st, right, where there was a huge cyber attack against Change Healthcare. From my understanding, this was basically some hackers had got in and said, hey, we have access to the data set from Change Healthcare, and they're saying, hey, pay us $22 million and we'll release the data set. If not, we'll expose it and all that. This was huge fiasco that happened in February. And I think it says Change Healthcare, it says it processes something around 30 million transactions per day, over 100,000 different hospital systems and providers on this system. So this is huge, right? This is one of the largest hacks we've seen in healthcare and probably in a long time. Don't struggle with billing anymore. Let us help you. We have a new program, Medical Billing Done Right, and it's specifically suited for medical practices and clinicians like yourself who are looking to understand billing. It's complicated. You may even have a biller, but it may not be done correctly. Let us just do simple audit to understand what your account receivables look like. How are you dealing with denials? Are there extra money that's just left on the table that you're not taking advantage of? So if you want to learn more, simply comment BILL, B-I-L-L below, and someone reach out to you immediately. So let's take us back to your side of it as a medical biller, Greg. So what did that look like to you when that happened? How'd you think through that process? Think about that hack and thinking through like how to get around this if you can no longer, because what happened was when the hack happened, or United Healthcare just admitted, say, hey, we can't process claims at this time, and they stopped. So basically all these millions and millions of transactions that are happening to process medical billing just completely stopped. So now you had providers, hospital systems scrambling to get compensated, to get paid for work they've done, because the clearinghouse was not processing those claims, and those claims are not coming back to them. So no one was getting paid during that period of time. So kind of walk me through like your thought process, high level as a medical biller. How do you handle that and think through that process to get around what was happening here?
Yeah, so we definitely experienced that. So I had seen something too along the lines of 1 in 3 Americans would be impacted by the Change Healthcare. That's market share that they had. We kind of went into emergency and crisis mode with a lot of things. So what we found out, one, there's a lot of clearinghouses that are ingrained with certain practice management. And so Change Healthcare was the preferred vendor for many practice management systems, for many EHRs, and for many payers, actually. So one of the things that we found out that we didn't have a lot of insight into previously, purely because I don't think we ever asked a lot of the questions around it, was there was a lot of payers who, no matter what clearinghouse you used, whether it was Change Healthcare or another like Waystar or Availity or one of the other bigger ones, what really was happening was a lot of these payers were exclusive to Change Healthcare. Even though they had a setup, you were set up with a different clearinghouse. That clearinghouse was then turning around and having to send the claims through Change Healthcare in order to get them to the payers.
So clearinghouse was using another clearinghouse to get their payments.
Yeah. And
we saw that in Georgia, the big Medicaid provider. They were using Change Healthcare to process their claims as well.
Yeah, and what we also found out too, especially here in Arizona where I live, some of the payers actually had their EFTs, so their electronic funds transfers, were dictated through Change Healthcare. So there were some payers that actually couldn't even release payments on the claims that they had. So they had to start cutting paper checks in order to get these providers paid. Really what we did is a couple of different things. One, I would say, to their credit, a lot of the insurance insurance companies did step up and make alternate pathways for claims to go through, whether it be Medicare for a long time, unless you could get a waiver, would not accept paper claims. So they would say no paper claims, everything has to be electronic unless you can get this waiver. And I don't know of anybody who actually got the waiver approved. Unless you can get this waiver, you can't send paper claims. And so Medicare actually started allowing paper claims to come through for the first time in a very long time in order to get claims out. And then many of the other payers, you have the option where you can drop to paper, but it takes longer. But then also some of the other payers quickly spun up alternate pathways, whether it was through another clearinghouse, through direct submission, through online portal entry, through online uploads, really finding a bunch of different ways to kind of get around the Change Healthcare issue. What was happening is then we were having to go back or having to have conversations with various clearinghouses and various practice management systems saying, hey, can I get this file? Can I get this in order to send this through? And so, there was ways around it, but it wasn't easy. Going forward, I would say, understand your clearinghouse, understand the limitations, and understand some more about how some of these payers work and how they process. Because what's happening is we couldn't get claims out, but then some of the payers couldn't even process them if they got them, and they had no way of finding that out. And then we also had the opposite problem where we could get them the claims, but then they had no way of telling us who was paid, which patients were paid, because all of the EOBs and ERAs were also sent out through Change Healthcare. So we had providers who were getting money, which was great. That was the good problem to have, right? You were getting the money, but you didn't know who it went to.
Yeah,
and
it was
so,
the matching issue, right?
Yeah.
How you credit that account and all that. Yeah.
How do you know what's still outstanding? Different things like that. And so it really caused a lot of different issues. And so my recommendation is always have payer portals if they're available, going onto their websites, getting logins associated with them. There are a few payers that use, the same website. So Availity is being a big one that has a lot of different payers attached, Navinet and a couple others. And so if you have payers that you use, especially your largest payers, I would recommend always making sure that you have logins set up so that way a couple of different things, if something like this were to ever happen again, which hopefully it doesn't, you have a pathway where you can go in quickly, see updates, because a lot of them were posting updates as to what was going on directly on those portals. Or if you have a portal user, they'll send out emails on the updates. But then also too, it gave additional pathways where, it may have taken a little bit longer. Some of them you had to manually type in all the claims information on the portal, but it was better than no money coming in. There was definitely a lot of opportunities out there to get around Change Healthcare, but I think a lot of people were caught off guard because they didn't have some of these things in place that could have allowed for a little bit of an ease or alternative pathways that, the payers were opening up, and they just weren't ready for it because they just assumed, I click this button in my EMR or my practice management, and then the claims go out and then they come back paid, and then I work them when they come back. And that was kind of their understanding of claims. And so definitely a lot of opportunity out there to have a little bit cleaner processes on your side and understand a little bit more about insurances and have better electronic access to many of these payers.
That's great. I love that advice to kind of have alternative methods, right? I came from engineering. They always said, always have redundancy in the system, right? And so you're dealing with one clearinghouse, make sure you have another one, or you have access to the claims in case things like this happen. It's always good to have redundancy. So, I think the challenge, I've seen, we work with a lot of independent physician groups. Obviously the big groups, they can handle the financial, load. They probably have some money in the bank, but it's really struggle for those independent physician organizations, right? Those who have fewer than 10 physicians. I think the American Medical Association did a survey of about 1,400 physicians out there, and they said this cyber attack really hurt them. They said 80% from this informal survey had lost revenue from unpaid claims. They said 55% of respondents had to use personal funds to cover practice expenses. Some of the anecdotal information is that this cyber attack may bankrupt our practice of 50 years in this rural community. It says our payroll taxes and gross receipts are not able to be paid, resulting in penalties. It says we are barely able to pay employees and can't pay our vendors. They just didn't have the bankroll to handle this attack. And so you're wondering if this is going to put even more pressure. I think this is a statistic said for after the pandemic, for the first time, independent physicians are below 50%. Most physicians were kind of like independent, right? Did their own thing. But now, with the pandemic, and burnout, they started to get acquired by hospital systems and private equity firms. Now this is just further pressuring a lot of these independent physicians to say, you know what, I think I want to get out of this. And so, what is your advice to them as they're kind of figuring out how to get through this process and kind of get on the other end so they can get their practice in a better path?
Yeah, I mean, two things. I think when you are an independent practice, there is a little bit of an economy of scale. So if you have, the more physicians you have, kind of the easier it is to manage. You don't necessarily need 1-to-1 biller to physician ratio and things of that nature. But what I would say, there is the ability to be independent still. I do think that it is still an option for many providers out there. I think one of the things that you need to do is make sure that you have a strong billing team and understand that it's not just hitting a button and watching claims get paid. It is definitely making sure that everything is flowing in, because your biller is going to be the one who's going to help you understand, hey, do we need to do something different at the front desk? Do we need to do something different when we're meeting with patients? Do we need to be doing something different before we treat patients? Different things of that nature. And so really having somebody on your staff who is understanding of that and understanding of the different nuances and has the ability to not only communicate with payers, but also communicate with you and your other team members in order to help you understand, kind of where the opportunities are in order to get better reimbursement and cleaner claims with quicker payment. The other thing I would say to independent practices is don't give up when you're negotiating with payers. So a lot of times you'll think, well, I'm just a small guy. The payer doesn't care about me. They got this group down the road that's got, 800 of me. They're going to help them. Really go and talk to your payers and find an insurance representative who's assigned to you, a provider rep at the insurances, and ask about your contract and understand what's in your contract and your rates. I can tell you an insurance isn't going to pay you more than you ask for. Really understanding your contract, understanding your rates with insurance, but then also don't be afraid to ask to renegotiate or increase your rates with the payer. And you may get a no, and you'll probably get a no, but don't be afraid to continue to ask and dig in. But I think there is absolutely an opportunity for, gone are the Wild West days where, everything can just be sent to an insurance and it gets paid. With the electronic claims, there definitely is a lot more rules that are set in place where if it doesn't meet XYZ, it's not going to pay. And so you're not having a person looking at it who understands it potentially or can assume what you were meaning on something. It's really, a system. And if it doesn't meet the criteria in the system, it's not going to pay. So really understanding that you do need somebody on your team to do billing and understand that you may not necessarily need a coder, but you definitely do need a medical biller on your team who can understand and help navigate the challenges with the different payers.
No, I agree. It doesn't hurt. This is a great time to maybe even bring in third party just to kind of see, how your processes have evolved over the time, and especially after this incident, the time to change is now, and to kind of, maybe it's time to really look under the covers and see how your medical practice is being run and how it's being built out. And there's an opportunity to make changes. And so don't be afraid to do that. I mean, you already experienced disruption. It's kind of like if there's a messy room and you say, okay, let me just get something in there. And he said, well, you know what, since I'm here, let me just clean up the whole room, right? And so this is an opportunity to do that. So I encourage all the independent physician groups and practices out there to have courage and make those changes now, because it's just going to be better for your patients in the long term if you have a financial stable practice, right, to kind of help them. And so a lot of the practices we work with are in those rural areas, right? And so if they're gone, patients, they have to travel hours, right, to get to another physician. This is something that is a dire importance, we believe. So Greg, no, this has been awesome, great insight and thoughtfulness around kind of how you're navigating. Where can everyone kind of reach out to you if they have further questions or thoughts about medical billing, or they're just interested in getting into the space? Where can they reach you?
Yeah, so I am on LinkedIn, Gregory Carlson. So only my parents call me Gregory. You can find me on LinkedIn at Gregory Carlson. And then also if anybody wants to shoot me an email, my email is kind of long, but it's Gregory.R.Carlson@gmail.com. I'm always happy to help. Like I said, I've been doing this for quite a long time. I've been in multiple different specialties and practices. And so always an opportunity to educate and help. And I grew up in healthcare. My mom's been a nurse for 45 years. I truly live and breathe healthcare. So anytime anybody has questions, I'm always happy to help.
Awesome. Well, Greg, thank you for your time. I appreciate it. And everyone, go check us out at all the different vehicles where we talk about remote care. We talk about medical billing. Our company, Practice Value Creator and SensorMed, are really there to help the independent practices get to the next level and help their patients more. So Greg, thank you for your time. We'll catch up later.
Absolutely. Thank you.